Hello. Welcome to our celebration of 2022 City Health Medals. We are delighted to have you with us today. I'm Patterson, one of the co-executive directors of City Health, and I will be joined a little bit later by my counterpart, Katrina Forrest. Today, we are going to share the results of our 2022 assessment and celebrate the cities of Boston and Denver, our two gold medal cities. For those of you who are new to City Health, welcome. I'd like to share a little bit about who we are. City Health is an initiative of the Beaumont Foundation and Kaiser Permanente. Our mission is to promote upstream, health promoting, and equity-centered policies in America's largest cities. Our goal at City Health is to provide cities with tried and tested policy solutions that can increase access to healthy choices and help people live longer, richer lives. Last year, City Health published the final assessment of our inaugural 9 policy package. And as you can see from this trend line, we had a high degree of success. In our final assessment, almost 93% of the nation's largest 40 cities had earned an overall City Health medal. That meant that 44 million people lived in a city with an overall medal in 2021. This dramatic increase in policy adoption was proof that city leaders were redefining their role in improving community health. So following that success, we made a commitment to raise the bar and expand our footprint. So why did we do that? Every 5 years, we take the time to really re-examine our policy package. And we do this to make sure that we can reflect city achievements. This past year, we really made an intentional commitment to equity. We also wanted to make sure that we're leading with the science and the most up-to-date science. And finally, we want to make sure that we are responding to local priorities and local contexts. All of that work culminated in the package that you now see on your screen. This package represents local policy solutions can address the critical health disparities in communities. As noted earlier, this package is designed to address the social determinants of health and to prevent health problems before they even begin. Our policy solutions are focused on equity. At our core, we believe that who you are and where you live should not determine your health status. Everyone should have access to healthy choices and the opportunity to live a healthy, full life. So I want to be really clear, we cannot do this work on our own. We are a small but mighty team, and we rely on our partners. I know that some of them are on the call today, and I just want to say thank you. Thank you for your partnership, and thank you for helping us work effectively within community. And for city leaders that are on the call, I want to make sure that you know we can connect you with these experts from these organizations to help you craft the right policy for your community. So 2022 not only saw an expanded policy package, but also an expanded footprint. We are now in the nation's 75 largest cities, and our team works from coast to coast. And we now also have a presence in Alaska and Hawaii, which is really exciting. So now I'm excited to get to the results of our 2022 medals and assessment. I think it's really interesting to note that right at the start, 49% of the 75 largest cities have already earned an overall medal, which means that 39 million people now call these cities their home. Congratulations to the 37 cities who have earned an overall medal in the 2022 assessment. Of course, we have to give a special shout out to our 2 gold medal cities, Denver and Boston. We're going to hear a little bit more from them later in the webinar. So I know there's a lot of information on this slide, and I want to describe it and then highlight a couple of things. These medals represent individual medals earned across the 12 policies. And when you're looking at this, several rise to the top in terms of those with a high level of penetration. And those are affordable housing trusts, green space, and high quality accessible pre-K. There are some other policies that had some lower penetration rates. And I think it's really important to highlight that these are areas for improvement within cities that are looking to move up in their medal status. And those are eco-friendly purchasing, flavored tobacco restrictions, and legal support for renters. You can find all the results for the 75 cities at our annual report at cityhealth.org. We also have our methodology outlined there, as well as a number of other resources for cities. So I welcome you to visit that and follow up with us. I'd now like to turn it over to my colleague, Katrina Forrest, who's going to lead a conversation with our gold medal winners. Katrina.
Thank you, Catherine, and hello, everyone. Once again, my name is Katrina Forrest, and we are about to hear from our exemplary city leaders from Boston and Denver, our two 2022 gold medal cities. But before I introduce them, I'd like to briefly celebrate their policy successes. Boston earned its overall gold medal, having earned individual gold medals in flavored tobacco restrictions, green space, healthy rental housing, high quality accessible pre-K, safer alcohol sales, and smoke-free indoor air. In addition, the city earned silver in healthy food purchasing and a bronze in earned sick leave, a truly incredible accomplishment. Similarly, Denver earned its overall gold medal from earning individual golds in affordable housing trust, earned sick leave, green space, safer alcohol sales, and smoke-free indoor air. Denver also earned a silver in legal support for renters and bronze medals in eco-friendly purchasing, healthy food purchasing, and high-quality accessible pre-K. I think it is abundantly clear that these are some rock star cities, and it is truly my pleasure to introduce our panelists. Joining us from Boston is Dr. Bisola Ojikutu. Dr. Ojikutu is a nationally recognized physician leader, health equity researcher, community advocate, and expert in the prevention, care, and treatment of infectious diseases. She was appointed executive director of the Boston Public Health Commission in September of 2021, where she leads 1,200 employees whose mission it is to protect, preserve, and promote the health and well-being of all Boston residents. Among other public health priorities, Dr. Ojikutu is committed to addressing racism as a public health crisis and advancing health equity. We are also joined by Britta, who was appointed as Chief Housing Officer for the City and County of Denver by Mayor Michael B. Hancock in June of 2018. She was further appointed to serve in the mayor's cabinet and as its first executive director of the newly created Department of Housing Stability in October 2019. Britta oversees the city's Affordable Housing Fund and Homelessness Resolution Fund, and she is the recent winner of the 2022 City and County of Denver Most Supportive Leader Award. Welcome to you both. We are truly honored to have you. I'm going to kick off with my very first question, and it's actually for both of you. And if the two of you are like me, you love the start of a new year because it is a wonderful time for planning and reflection. And 2022 was in many ways a year of change. We saw most places experiencing a loosening of their pandemic restrictions, children returned to schools full time, and many of us just simply adjusted to this new phase of life living with COVID. As policymakers and leaders in health and housing, what are you both most proud of in terms of what you all achieved from a departmental or citywide standpoint in 2022? And what are you most looking forward to this year when it comes to your cities and health? Dr. Ojikutu, I will kick it to you first.
Sure. Thank you so much, Katrina. And first, I would like to thank CityHealth for the work that you do, the incredible work that you do to advance evidence-based health policy solutions and to amplifying the ongoing efforts to promote health within many cities around the country. And of course, thank you so much for recognizing Boston once again, and specifically our work to advance health equity. I think that your question is one that's on many minds as we start the new year. I think it's a completely, it's really a part and parcel to how we sort of start our new year, is kind of taking stock of what we've achieved in the past and kind of moving forward. I think right now, what I would say is that we see a lot of momentum around health equity. And I think that's coming from what we've experienced through COVID-19 and sort of looking at the lessons learned as a health department from the first few years of the pandemic. Just to name a few: community mobilization, the need for community empowerment, community investment, the power of data, and the fact that we know we need to shore up our data, as well as, utilize new technologies, which we are strengthening and really working towards. And just the essential role of trust and transparency and clear communication with communities, and the need for us to really build upon our public health infrastructure if we want to continue to do all the things that we've been known to do throughout over time here in Boston, just to name a few of those lessons. I think that the important thing going forward is to say to ourselves, well, then we know that these things were challenges. We know that we were able to do some remarkable things, and like many cities during COVID-19, particularly in getting people vaccinated, getting people from sort of a test to actually getting treatment for COVID-19. Okay, so now how do we translate those lessons and all the things that we did and all the novel things that we were able to implement into all these other health inequities that we're dealing with? I mean, certainly across chronic disease areas, as well as, beyond chronic diseases, but looking at social determinants and all the things that we need to work on. So what we're trying to do is come up with strategies that will actually translate a lot of what we've learned into other areas of health inequity, and to build upon the significant momentum that I think has been sort of motivated by what we've seen throughout the pandemic. I think the challenge, though, is figuring out, as we all know, particularly within public health, is that we're always worried about funding. We need to have better and more sustainable sources of funding moving forward as we think about what we need to do next, and how do we tackle all of these sort of non-pandemic related issues when there isn't necessarily the overwhelming momentum over time to deal with them. So how do we sustain what we've learned? How do we use what we've learned to address other issues? These are the things that we're looking forward to as the year goes on, as we enter into 2023.
Good morning and good afternoon in some areas. I'm Britta Fisher, and I'm the Chief Housing Officer for Denver. And when I think about this past year and what I'm proud of, I'm really proud of what we've built here in Denver as a department. The Department of Housing Stability has only existed for 3 years, and we've now seen 5,000 people leave an episode of homelessness and go into stable housing. And that impact for our residents is what I'm very proud of. We've created or preserved more than 2,000 homes that are affordable here in Denver. 225 of those that have opened have been supportive housing. So it's housing with those wraparound services that are so key to helping people obtain and maintain housing. So I think those are some of those accomplishments. One that I would add is that in each of the last 3 years, we have had a ballot measure that was on housing or homelessness that was passed by Denver voters that created additional dedicated funding and bond funding as well, and keeping those revenues to be invested in accordance with our 5-year plan. So when I think about this leap forward that we've taken here in Denver, and I think about the team that we've built over these 3 years. When I started, we had 15 people, and in 2023, we'll have 131. And so it's been a tremendous growth, and I'm very proud of the people working very hard to support our community and all of our community members who work every day to deliver on the programs in our community. So I'm proud of that. As we look ahead, I would say there's 2 things I'd draw your attention to. One, we have always known that housing plus supportive services works. We've done a social impact bond here in Denver, and that is going to be continuing in a new iteration called Housing to Health. And this is through the Social Impact Partnerships to Pay for Results Act. And so that is now underway for another 125 households to measure, with funding from the U.S. Department of Treasury, the savings to Medicaid and Medicare when we house people and provide health services from that foundation of housing. And so I'm really excited about what that can mean for federal policy. It won't just be a 2023 thing. We take a long time to evaluate things like health outcomes, but I'm very excited about that. And then one other that I would think is worth mentioning is that we have here in Denver, the Denver Basic Income Project, and we are spending some of our ARPA recovery dollars on that. And the longer that I've been in this work, the more that I am very supportive of getting resources to the people who simply need resources. And so basic income is really betting on the autonomy and the resilience of our residents here in Denver to solve some of their issues and challenges with cold hard cash. And that is something I'm really excited to see us investing in, to say this is how we can mitigate some of the impacts of the COVID-19 pandemic, is by getting resources to the people who have been most impacted. And so I'm really excited about that as well.
You guys have an incredible amount to be proud of. I love hearing your specific reflections. You each also touched on the equitable approach that you're taking to your work. And I want to drill down a little bit more into that, because this year, CityHealth raised the bar by adding new policies to our package and also strengthening our criteria for other policies. And part of that calculus was for us to put equity at the front and center of our policy package. And so now each of our criteria has an explicit equity component. Dr. Ojikutu, you talked a lot about the momentum around health equity. I hope that's something that continues. You talked about community investment and empowerment. But I'm curious, from a practical standpoint, what does that look like? How do you both factor equity into your work, and how do you ensure that those most impacted are getting what they need? And Britta, you also mentioned, making sure that people have the resources that they need, and that's why you were excited about the basic income pilot. But I want to hear more for other city leaders that are listening. How do you make this actionable? What are you guys doing to really center equity in your work?
So
Britta,
I can.
I'll go to you first.
Oh, okay.
We'll swap it.
Okay, great. Well, I'm really proud to work for Mayor Hancock here in Denver, who has an equity platform. He also has a very personal story with housing instability and homelessness, as someone who grew up here in Denver as the youngest of 10 kids and experienced homelessness in his youth, and then also moved into public housing and saw the tremendous benefits to him and his siblings when they got that stability. And so it's an honor to work with him and to have that kind of political leadership. We also have, as a city, our strategic plans, and our strategic plan here in the Department of Housing Stability, our main goal is that race no longer predicts one's housing outcomes. And leading with equity means that we are measuring that in every way. So if we are having success, but it isn't racially equitable, and we are not having equitable outcomes, then we are not having success. And so we have a public dashboard that shows our progress. We have broken down how our results are working, and we're tweaking them along the way. I think the most important thing currently just came from the Emergency Operations Center here in Denver. We're in an environment where we have had a lot more sheltering to do lately. And when we were in the bunker, as we call it, at the beginning of COVID-19, we stopped and asked ourselves at every point with our chief equity officer, what is the impact of this decision? So before we do something, who is benefiting? Who is burdened? What kind of unintended consequences might there be for this action and decision? And that's something that we've internalized to our department and to our work, and something that we see from our equity, diversity, and inclusion team, bringing forward ideas on how we can better live into our values. We're seeing that across our department. And so I think that operationalizing is both those points of inflection and asking ourselves those important questions, welcoming and learning and growing as an organization, and then of course measuring how we're making that difference.
I love that. And I love the inside outside. You guys are asking yourselves hard questions to then figure out what is the impact externally. I love that. Dr. Ojikutu, what about for you? How are you guys actualizing the equity work and making sure that it's at the center of all you do?
Sure. So the Boston Public Health Commission is one of the oldest health departments in the country, and issues of anti-racism and social justice and equity have been at the center of our mission for decades, before people were even really using those terms. But I think you ask a key question. A lot of this can be very symbolic as opposed to it actually being operationalized. What does it really mean? And I think that comes to mind when you think about the declarations on racism as a public health crisis. We know that 200 plus jurisdictions made these declarations, and I think that's the key question: is how symbolic is this versus actionable? So here in Boston, what I would say is that unlike some of the other cities, counties, that have made these declarations, it actually has become something that's clearly operational, because we were given funding that's now within our city appropriation budget to do things that are actually meaningful. And that hasn't actually been the case across the country. And it's been a challenge, I think, for many of my my counterparts in other cities, counties, and jurisdictions. So, for example, when this was first declared, which is in 2020, so it was our previous Mayor Walsh, and then carried through by subsequent Mayor Janey, and then now Mayor Wu. What my predecessor did, I think, was very instrumental. Instead of first looking externally, they decided, let's look internally at the public health department, and let's see what processes and procedures we can actually address from an institutional racism perspective to change how we operate, so that we are leading the way, as opposed to, just initially, kind of looking externally. So an anti-racism policy was established in 2020. Within that anti-racism policy, there is a very detailed overview in terms of equitable budgeting processes, which we use today as we go through each of our annual budgets. Equitable procurement policies, so bringing vendors to the table, using Q vendors, so people who are underrepresented, who otherwise would not have access to lots of the resources that we have available, making sure that they have an equitable, I should say, opportunity to utilize resources to grow their own businesses and consultancy work that they're doing, and of course enhancing diversity, equity, and inclusion. I think that we have made significant progress internally and developing policies that are now used across city departments. I think the other piece of this was just slightly less tangible, but equally important, because there have been a number of papers written about just racism within public health departments and white supremacy actually in public health departments. So creating a culture of belonging within our own commission, I think, has been critical. Making sure that our staff actually reflects the residents of Boston and actually brings those their concerns to the table and are able to serve as advocates. I think that's key. So now we're at the point with this city appropriation that we are now going to look externally. So now what is it that we can do with these funds to look at structural racism? So now we're moving from institutional to now looking at what's happening from a systems perspective. And I think structural problems deserve structural solutions. So we're really looking at policies and practices, particularly a lot of cities have thought about restorative justice and looking at housing policy. Well, we're trying to focus in on education and what is it that we can do with our funds to actually ensure, because education, key social determinant of health, obviously relates to health outcomes. We offer a lot of opportunities to young people. Can we now think about need-based scholarships for them and scholarships that lead them give back to public health careers, because the issue, of course, is that we need to build our workforce pipeline, and we had significant attrition, as most public health departments have. So this is something that we're looking forward to in moving forward in the future, and it's something that we're obviously quite dedicated to in Boston.
I love the ways that you both have prioritized this and talked about the internal work, the external work, focusing on the institutional challenges and barriers, and also then looking outward at the structural and systems level challenges. We did have a question that came through as you were speaking, Dr. Ojikutu, and someone asked, what types of metrics are being used to capture the progress of anti-racism efforts within the department?
So I think that that's an important issue. We certainly must be tracking what we're doing. That's sometimes easier said than done. And it's easier for us to look at, sort of diversity as a factor, right? So we have human resources data that shows, how we progressed over time in terms of who is actually working at the commission, which is certainly important. And I think is critical to what we're doing. And I just want to comment and say that we have made progress, but we have a lot of work to go. I mean, we do have a considerable number of individuals who are African-American, Black, or Latinx. However, a lot of them are sort of middle management positions. So we want to make sure, as we're thinking about institutional racism, that we're offering a equitable professional development pipeline, within our actual department. So that's key. I think another piece of this that we're looking at, and we're doing this within the context of a workplace improvement initiative, we call it WIN within the Boston Public Health Commission, is that we're looking at staff appreciation and staff feeling as though they really belong here, which means doing surveys. And we did one back in 2021 to kind of see how is it that people are feeling about being here. As I mentioned, there's that culture of belonging that's such a huge piece of how we actually work as a health department. And we found that we have deficits. So we are going to repeat that after implementing these different initiatives that I've mentioned, and actually see where we are. So I think that there are a number of pieces of this. I think certainly we're also following our vendor demographics, as I talked about, equitable procurement, which I think is really important, and our budgeting process, like what neighborhoods are money's going to, and are we being equitable, considering that we, know that certain neighborhoods actually, are more vulnerable or more at risk for, some of the challenges that we're dealing with. So all of these are important as we're thinking about our anti-racism policy.
Awesome. And I will just offer to that as well. I think equity is both an outcome and a process. And so it's really important that you are tracking metrics along that continuum. Mm-hmm. CityHealth really does model a health in all policies approach, because health is truly a cross-cutting issue that intersects many different policy domains. But at the same time, and I know this well, I spent 6 years in local government, work across the city can become siloed. And sometimes that leads to missed opportunities to learn alongside your partners and also address problems holistically. I would love for you both to talk about the importance of interagency coordination and cross-sector partnerships, particularly with businesses, and how you both have prioritized and operationalized that in your cities. I will come to you first, Britta.
Thing. Well, I have already mentioned the 5-year strategic plan, and that was done through thousands of stakeholders giving us feedback, and many of our residents, and we put a real value on lived expertise as part of that. So people who are utilizing programs, who are in experiences of housing instability and homelessness, and hearing directly from them on what they need, what they think about what we have delivered, and how it can be improved. We spend a lot of time with stakeholders. I totally agree. I've been in the nonprofit sector until this particular appointment of the last 4.5 years. And I understand now, being on the inside, that gravity towards City Hall, there's so much to do within a big bureaucracy that there can be that pull. And I think it gives me great information here as a community advocate as well. And what I would arm anyone with is that, we really need to hear from our partners. In government, a lot of what we do is creating policy and delivering resources to those that are doing the work. And if we are not hearing how the doing is going and how we might be having unintended consequences of our best intended policies, then we're not going to be able to deliver on our outcomes, particularly in an equitable way. So in our 5-year strategic planning and process also has now a yearly action process. Again, we hear from the public. We have a housing stability strategic advisors group, again, with a focus on lived expertise. There's a lot of people with professional expertise that have a lot of access to local government, and that's why we've put such emphasis in that area. We also, since we like to do a good survey as well here in Denver, we do an organizational racial equity assessment, and that ARESA survey includes many questions to make sure that we are seeing how at all levels of our organization and our management, we are having the equity impacts that we want to have and where we have to grow. And we're transparent. We release that to our partners and we ask them to do the same. And that's why I can confidently tell you the majority of our staff here at the City of Denver who do this work in housing stability are people who have lived expertise. And we value that highly. So I also want to give a shout out on coordination within the city. Of course, working across agencies is always important. I just came from a cabinet meeting earlier. And, you know, we are all serving the same people. We're looking at different aspects. We're looking at different lenses, particularly in our own agencies, but we need to look at the same whole person. And I really am proud and excited to work together with people like Marion Kolb and Tristan Sanders, who were also part of major policies that resulted in this gold medal. So I just wanted to give a shout out to our folks over at Denver Department of Public Health and Environment, and to the many city agencies across these 12,000 coworkers that I have that have been working hard to deliver for residents and support their health and well-being.
That's fantastic. And I love that we are all serving the same people. I think that was beautifully stated. Dr. Ojikutu?
Sure. I mean, I think that this is a really important question because oftentimes across city government, people work in silos, and breaking down those silos is just so critical to getting any common goal accomplished. I would say that integration, collaboration across city departments and institutions, whether it be housing or policing or education, really is essential to achieving every goal that we have across Boston, and it's our standard practice. I think the other piece to this, though, as we think about working across city departments and city agencies, is really our close partnership with communities and community organizations, and making sure that we're all sort of talking as one. I would like to give an example because I do think, going back to your previous question, it really is about being actionable, you know, and what does actual collaboration look like in practice? So throughout the course of last year, we've been working in close partnership with the Mayor's Office of Housing here in Boston in our tent encampment to housing program. And essentially what we've done is we've moved people from living in tents in an area of our city to temporary supportive spaces, 6 different locations throughout the city. And as is the case in many cities, Boston has been challenged by this intersection. And I know my colleague mentioned this, of substance use disorder, co-occurring mental health challenges, and unsheltered status. And it led to this large encampment in our city with many dangers, as we're all probably aware of: crime, overdoses, human trafficking, as well as transmission of communicable diseases. So as of December of 2021, we established a transitional housing spaces around the city, both congregate and non-congregate sites. And this was really under the direction of Mayor Michelle Wu. And, you know, I really commend her for, you know, driving that forward very early in her tenure after beginning as mayor. And like I said, in very close collaboration with the mayor's office on housing, but also in collaboration with the Boston Police Department, because they were certainly and have been, you know, very much so involved in our work in this area of our tent encampment, as well as other, you know, city agencies and certainly City Hall administration. So this is really a housing first policy, and it really acknowledges that in order to promote the road and the journey through recovery, stable housing is just this critical piece that we all must sort of get behind, and we all must sort of work toward. And I think this is a good example, not only of us, having a common goal, but it's also using shared funding. We were pulling from pots of money from different agencies, from different institutions, again, working towards a common goal. And it's worked extremely well, and I think that we're going to continue to build as we both build on this particular both policy and practice throughout the city of Boston, but to look to expand it. And where is this going? And I just want to mention the equity piece of this, because we're all also on board in terms of looking at this from that equity lens, because we do know that there are significant inequities in access to medication for opioid use disorder, for housing for people who are unsheltered, who are living with substance use disorder. So we recently obtained a grant from the Office of Minority Health, HHS, to look at structural racism in housing, and particularly as it relates to individuals living with substance use disorder. And I have to thank Congresswoman Ayanna Pressley for her assistance, collaboration. She's the one who really pushed forward for these funds to be available across the country. And one of those awards did come to us. So with that award, we're working very closely with the carceral system. So all aspects, including our sheriff's department, our city and county jails, as well as the police department, as well as housing and numerous other agencies. And I want to mention that we're working with peers, so people who are experiencing substance use disorder, so some of the substance use disorder unions, to pull this together so that we're actually meeting their needs. And it's driven really from the community up. So I just want to mention that as a very practical example of how we're collaborating across city agencies to accomplish what I think has been a wonderful goal. And I want to thank all of our partners who've helped move that forward.
I love that. And I love the intentionality with which both of you are approaching your engagement of stakeholders. Again, Britta said beautifully, we're all serving the same people. And Dr. Ojikutu, you put a finer point on that by asking the question, what does actual collaboration look like? And I think you both have talked a lot about what it means to model true collaboration. And I think that's incredibly powerful. My next question is actually for you, Britta. And Dr. Ojikutu teed us up nicely for this, because at the top of nearly every city's list of priorities, housing is unquestionably going to be on that list. And Denver earned a gold medal for its Affordable Housing Trust, as well as a silver medal in our legal support for renters policy. And you guys are on the cusp of earning a medal in our healthy rental housing policy. Denver's dedicated Affordable Housing Fund creates and preserves housing for people at a range of income levels, including people experiencing homelessness. How has that fund impacted the availability and affordability of housing in Denver? And how do you ensure that those funds continue to meet the ongoing needs of those who are most vulnerable?
Thanks for that question. And, as all good ideas, many people were part of it and had ideas for it, but we've gotten it done. And to answer your question, we have now reached 26,000 affordable homes here in Denver that are income restricted and are growing that more quickly than ever before. But we also asked ourselves a question about is it the number or is it the impact? And you can see in our strategic plan, we've done some really great analysis about, there's really not been any unit of affordable housing produced at 60% of area median income and below without government subsidy in well over a decade. Like there's just not, in a high cost housing market like a Boston or a Denver, really the margins for the cost of that unit to be paid for the rent for folks who are earning what is a decent amount of money in the market maybe, but is not when you look at the market of costs, right? So in the market of wage earning versus the market of housing, it's not keeping pace, and our wages have been relatively flat and our housing costs have been steep. And we're all feeling that pressure across the country. So we have seen more housing units created. I've talked about the 2,000 created and preserved in the last few years. And we have done it in some innovative ways. We've been able to take some of that affordable housing fund, and I should talk about its evolution just real quickly for you. We had in 2016 created an affordable housing fund with some general fund and other dollars, primarily property tax. And then in 2018, doubled that with retail marijuana tax, which is something we get asked about a lot here in Denver. And we were able to take a portion of the property tax then and dedicate it to the Denver Housing Authority, and they were able to bond against that so that we could deliver $129 million up front and create thousands of units, 2,500 units faster. And so that has been one of the innovative ways that we've been able to use that affordable housing fund and see what can be a long process in housing really front loaded and delivering more housing now. And so we're very excited about that. But we also know that we need to reach deep in our subsidy, that we need to target the lowest incomes, because that is what the private market will never produce. And so we certainly have been putting a lot more towards supportive housing. We have about 2,000 supportive housing units here in Denver now, and we have another 1,500 in the pipeline. And really proud of the team working hard with development opportunities across the city to say, how can we help people to exit homelessness and get into housing, because that is where homelessness ends, is in a home. And so the other thing that I would just add here beyond the dollars is that the dollars will only go so far. And so we've developed a couple of mighty policy tools as well. Expanding housing affordability really is something that Boston's way ahead on, which is having the private market really participate in a much bigger way in delivering affordable homes in the community. And so there are requirements that if you are building in our community in Denver, you have to deliver between 6 and 12% affordable homes as part of any residential development, or pay a fee in lieu. And so that has been a real game changer to getting a bigger scale for what we need here in Denver, and many other communities face that as well. The other one is prioritization policy, really looking at how we can help keep people who are in Denver and want to stay in Denver and are getting priced out and facing involuntary displacement. How can we prioritize them for affordable housing, as well as those who've already been displaced and want to be restored back to Denver, and those who are in the ultimate displacement of experiencing homelessness. So I would say that has really changed the landscape, and I think the hope in our community that we can do as much as possible to create affordability for people in Denver.
I love that. And I will say, I think Denver is truly one of the exemplars in the housing space. The way you have utilized your funding, the creativity with which you are directing dollars to really target those most impacted and most vulnerable is admirable. So I really appreciate all of the incredible work that you guys are doing and the example that it provides to other cities.
Thank you.
Dr. Ojikutu, for you, a really interesting fact is that the city of Boston is the only city that we have ever assessed that has earned a gold medal in every year of our assessment. And we have been doing the assessment since 2017. So I think the city clearly understands the value and importance of local policy and also the prioritization of health. I'd like to hear from you for other cities that are looking at Boston as an example. How would you help them to understand the role or need for local policy to affect equitable health outcomes?
Mm-hmm. So I think that's a great question. Boston has been very successful at establishing local policy that has been an example for others to follow at other levels, or certainly in other cities, but that also promotes health equity through our Board of Health and our structures. what I would start by saying is that my predecessors have led the way. And I think that it's important to acknowledge that, former Executive Director John Auerbach, who's now with Trust for America's Health, and certainly Barbara Ferrer, who's now the commissioner at LA County, were particularly instrumental in moving these policies forward during their tenure. I mean, some of these policies include really significant work that Boston has done around tobacco control, smoke-free workplaces, restrictions on blunt wraps, tobacco 21 and menthol restrictions. So really key fundamental issues in relationship to public health. I think that it's important for us to kind of look at what those policies actually achieved and having a clear sort of understanding of how to lead with data in the impact of the policies, and then to disseminate that so that people understand how important this was for the local government to do this, and then move that forward into sort of other levels. I think a couple other things I would add to that I think are really important for other city leaders to understand is that an important aspect of this was community engagement. And I think, we all, say we do community engagement. I think that's sort of part where you have like a community advisory board, or we have people who say they're from the community at the table, but it's really about having this sort of platform it's really open to equitable and bi-directional community exchange. And so that you're appreciating the lived experience and the expertise that people who are in our communities have as to why this is so important. And part of that is going sort of just back and forth, educating, but also appreciating grassroots advocacy, because I think that is so key. I do want to say also that there are certain, challenges with going first, being a forerunner in these areas. And that's something to pay attention to as you think about leadership. I think that with any of these policies and practices that are sort of forerunning, they are usually done in the context of, threatened legal challenges and opposition from many different, perspectives. And it's like, how do you move that forward? How do you come up with a strategy that brings people to the table? Because there's always a middle ground, I find, and even putting the examples that I gave aside, going back to the one I gave before about the issue of building these spaces, these low, we call them low threshold spaces, where people who are still, actively experiencing substance use disorder are able to continue to use, but they're also engaging in services and putting them into communities where people are living. And then we all know NIMBYism exists. So then there's this back and forth, and trying to figure out how do you do this without, in the face of conflict and adversity, how do you do it? And I think that going back to this issue that you're talking about with policies at the local level, because I look at this housing first, tent to housing initiative as both a practice and a sort of a local policy that we're trying to move forward in an official sort of way, is that we lead with data. So we're showing that nothing different is happening. Crime is not increasing in these areas. There isn't increased needles. We haven't had more calls to do needle pickup in the areas. We haven't had necessarily more overdoses than we would have had. We've had many fewer overdoses than we have in our tent encampment. So it's leading with the data, leading with the evidence base, knowing how to disseminate that and bring people to the table, because honestly, people will listen if you speak to them and speak their language, you know what I mean? And actually address their needs. So I think that's really how I believe that Boston has been successful, is really bringing people to the table and engaging them in the decision-making process.
I love that. And I want to go back to one of the things that you mentioned, because you said it's important to look at what the policies achieve and then figure out how do you lead with data. And listen, CityHealth is a policy shop. We believe in policy shop, but we are not deluded into thinking it is a panacea. And you had mentioned something earlier, and it raises a question that is here in the chat. Someone said, you mentioned earlier the unintended consequences for initiatives or policies. How do you assess these and express the importance of evaluating those unintended consequences throughout any project? And I'd love to hear both of you respond to that. How do you assess the unintended consequences?
I think that's why, as Dr. Ojikutu said, you lead with data, right? So you can see not only your intended outcome, but all factors surrounding that issue. And And then I think we all have blind spots, right? We have how we think something's going to work and then how it actually does. And I think that's where it goes right back to those community partnerships. So we meet a couple times a month with the Homeless Leadership Council, which is the largest shelter and service providers here in the city and county of Denver. And we meet with the Anti-Displacement Network, which are nonprofits working on anti-displacement techniques, and our Neighborhood Development Collaborative, which are the largest nonprofit developers of affordable housing in this area. And we continue to grow those tables to include smaller organizations that are not always as savvy in getting all of the government resources and so forth, and at examining those barriers that are in their way, as well as we seek those equitable outcomes. But I think you have to be listening for what are the shelter workers saying, what are the frontline food pantry workers experiencing, what's happening in the healthcare clinic that we didn't see before, what's happening at the Office of Medical Examiner, and who's dying in our community. And we have to look at all of those factors and have a well-rounded feedback loop in order to understand unintended consequences. So we definitely need to set baselines. We definitely need to make measurements, but we also have to be open to hearing from our residents and hearing from our people about what is happening in their neighborhoods, in their communities, and in their families.
I absolutely love that. And you've talked a lot about listening, and that is a real skill, active listening, and not listening with the spirit of wanting to talk or explain to the community what they need. They know what they need, and we just need to listen to them. Dr. Ojikutu, for you as well, that same question around how do you assess the unintended consequences?
Well, I agree with everything that has been stated thus far. I think what I wanted to add is when you establish that baseline, you have to be clear about what you know versus what you don't know. You have to be transparent. I mean, we don't know what could happen if we do X or we don't know every detail. We don't have a crystal ball, but I think people appreciate, and it helps build trust if you say, we're going to continue to look at this, and we're going to look at it together, and we're going to address things as they come along, and we're going to be as transparent as possible with the data as we move it along. And we're going to make sure the data is understandable to you. We do a lot with dashboards, and I'm sure other cities, I know Denver does also, with, make things so that people can actually follow it along themselves and think about the decisions that are being made and know, well, okay, we implemented an intervention here. Well, this was the consequence of it. Well, was that a good consequence, or was it a bad, or was it something in between? Having ongoing communication, I think, is just so critical to everything that we do. And again, it breeds a sense of true partnership and collaboration, because, we're all, as Britta already said, we're all serving the same people, so we have to think about who they are, and do they have the information to also to help us make informed choices.
And I love that very basic, we have to be honest about what we know and what we don't know. It's a simple thing, but I think it is critical. Mm-hmm. I could talk to you both for hours, but we are coming up to the end of time. So I have one question for each of you, and I will come to you first, Britta. Because housing is so top of mind for so many people, again, it's one of our more intractable issues, and lots of folks are grappling with this. I'm curious to know, what are the most interesting trends in housing that we should pay close attention to in 2023, this year?
There's a lot of things going on, but I'll bring note to a couple. We have decided in this country that we are not okay with people going hungry. We have decided to subsidize that when people are, with their resources, unable to compete in a market-based commodity like food, we subsidize that. And we really have committed to subsidizing anyone who can't get that essential basic need. We've not decided that about housing. And we have, I think, outcomes that show our tolerance of people being unhoused. and we have systems that could help more people. But we currently see, like with our housing choice vouchers, which is a housing subsidy to help people who can't compete in this market-based economy with the fewest resources, we have decided that it's okay to have game show odds for housing, that 1 in 5 families who qualify for that benefit actually receive one. And if we are going to reach the scale of the need that our many communities are feeling of all sizes right now, we are going to have to think about this differently, because in this housing market, the people with the fewest resources will always be left out, and there is no market incentive to serve everyone in that way. And so we have to think about our policy tools, our investments, and we have to pressure who we are as a nation to think about what can we do together to say this isn't acceptable, that housing is something that is basic, that we need to providing this resource at the level and with the scale that we see. So I'll take my moment and say what those 3 things are in 2023. It is to say that we need more vouchers. I think if we wanted to, really see the scale of impact, housing choice vouchers and project-based vouchers for housing projects would be one of the top things. The second would be utilizing this big tool that we have with all of its flaws. It's still been getting a lot of housing done, and that's the low-income housing tax credit. And if we could triple the amount of tax credits and reduce the private activity bond cap test from 50% to 25%, we would release billions of additional capital that could be leveraged with other capital in our markets. And then finally, for me, services. And this is really that intersection of health and housing. We have seen some successes with Medicaid covering services that could be paired with housing to help with the whole health and well-being of people. We've seen it save money, but again, we need to find more ways to pair services dollars with housing for the people, because we're serving that whole person and they need both those things.
Whew. I'm going to say, when you said we have accepted a different standard for housing, that took my breath away. But I just want to repeat again the 3 trends that you said we should be looking out for. You need more vouchers in 2023. That's housing choice vouchers, project-based vouchers. You need to better utilize the low-income housing tax credit. And we need to increase our service level.
Up, up, and up.
Thank you so much for that. I actually had a different question for Dr. Ojikutu, but I think I'm going to stick with the same one. So what are the most interesting trends in public health that we should pay close attention to in 2023?
So there are a few, and I know we are short on time, so I will just talk about a couple of those that I think need to be highlighted. One, I think everyone is aware, based on our experiences in the last few years, that public health is unprepared. We are not prepared to deal with pandemic threats. We have not been funded at an optimal level over decades of time, and we boom and bust. If there's an emergency, then certainly there's an allocation of funding. And then when that emergency seems to, no longer be of the utmost concern, then those dollars go away. So we don't have the ability, if something does happen next, even, as we all saw with monkeypox on top of COVID-19, struggle, just the scramble to actually meet the needs of many people who are at risk and who remain vulnerable. So I think everybody's aware of that. It's fixing it that I'm not quite seeing the way forward. Lots of ideas, lots of people who are advocating just sustainable funding streams. Like instead of coming from different funding sources, actually having just clear sustainable funding streams from the federal government. I think we need that. And it needs not to ebb and flow. It needs to actually just be consistently high, because if you think about the achievements, if you think about life expectancy in the United States globally, and you think about what is actually extended life expectancy, it has been achievements in public health. It has not been what has happened in healthcare. Okay, it's been clean water, it's been traffic safety, it's been cleaner air, it's been tobacco control, and vaccinations, of course. I think the other piece to this is that if you look at our infrastructure in public health, if you're going to invest anywhere, you have to invest in our workforce. If you look at our own staff turnover rate, it was 7% in 2014. For the last couple of years, it's been 15%. And we are a relatively large health department. It's a lot of people. We have a lot of openings. We don't have the people to do the work. And that's one of the major reasons why we're not prepared if something happens. And that's why developing our pipeline is so important. So the CDC is now investing, and many of the cities and states and counties across the country have now received an influx of money. But the question is, okay, so that's a 5-year influx. What's going to happen in 5 years? What do we do from there forward? If we really value all of these wonderful achievements that have been accomplished by public health, then we have to maintain the funding over the long haul. I think those are the two big ones that I think need to be highlighted and amplified. I think the third one, in terms of themes, I mentioned this before, is that there is momentum that has been amplified around health inequity and around racism in all its ugly forms. Are we going to harness that momentum and move it into other areas? Are we actually going to use the lessons that we've clearly learned that are right there, that many people, including myself, have been speaking about, writing about over the course of these 2 years, to do something in these other areas that actually do cause the life expectancy and inequities that we know exist throughout our country? So what are we going to do differently? That we're at an inflection point. Are we going to follow that inflection point? Or are we going to go back to step one and forget about the lessons that we've learned? So those are the three things that I think are most important in terms of trends. And I'm hoping that people are paying attention.
That was beautifully stated. To wrap that up, the three things that we should be focused on are sustainable funding streams, investments in workforce, and being intentional and explicitly addressing racism and health inequities. Mm-hmm. Thank you both so much. I hope everyone is giving these folks a virtual round of applause, standing ovation. This was such an extraordinary conversation, and we so appreciate you taking the time. I am going to turn it over to my colleague, Catherine, to close us out.
I just want to humbly repeat everything that Katrina has said. Thank you to our panelists. What a rich contextualized conversation. We so appreciate the fact that you were willing to share the stories about the work in your communities. And also thank you to Katrina for moderating such a fantastic conversation. Please visit our website to learn more. We'd also love for you to join us by signing up for our newsletter. Please also follow us on social media. Thank you so much and have a great day.